Knee pain is a common complaint when children are going through a growth spurt. We often tell children they should rest or that they'll grow out of it, but that rarely helps them to cope with their symptoms at the time, and many children drop out of sport as a result. Kids do grow out of most of the problems that occur during adolescence, but it can take a long time to wait, and recent research suggests that around 56% of 15 to 19-year-olds with knee pain still had that pain 2 years later. With the right management and education, we can aim to reduce that figure. Patellofemoral pain is an umbrella term used for pain resulting from the patellofemoral joint or from the surrounding soft tissues. The patellofemoral joint is made up of the kneecap, which is held within a groove on the front of the thigh bone by the quadriceps muscles and tendon and several ligaments. Any of these structures can contribute to pain, which is most commonly felt at the front of the knee. Another term, therefore, used for patellofemoral pain is anterior knee pain. Children with patellofemoral pain usually present with a gradual onset of pain in the front of the knee. It often gets worse with activity and settles with rest, although many patients find prolonged sitting with the knee in one position does aggravate their pain and has led to the term cinema or moviegoer's knee. Some people may experience swelling around the kneecap, and the knee is often noisy, clicking or grinding. But despite not sounding great, it's not related to pain levels and does not indicate that the tissues are damaged. If the pain persists, it can feel like it hurts all the time, but try to work out what aggravates the pain so you can minimize those activities for a while. The pain is often felt in both knees and easily aggravated by activities like squatting, lunging, and walking or running down hills, although for some people it may be both going up and down stairs that might provoke their symptoms. The kneecap can be irritated when it gets compressed in positions such as kneeling, sitting, or wearing tight, skinny jeans. And also different footwear can also affect knee pain. It can vary between wearing high heels or, for others, very flat shoes which lack support. Everyone is different. Patellofemoral pain is common in adolescents who participate in repeated high intensity and higher volumes of hopping, jumping, and change of direction type activities. But it can also occur in children who are more sedentary and in adults too. Symptoms usually start around age 12 to 19 years of age, and some may last for prolonged periods of time or settle and then recur. Those more at risk of persistent or recurrent pain are more commonly female, especially those who've got higher levels of pain when it first starts, and those who are generally less active. It's also been noted that children who are hypermobile and those who are neurodiverse seem to experience more prolonged or severe symptoms. A trained health professional will know what signs and symptoms to look for and be able to diagnose the condition without x-rays or scans. They'll ask lots of questions about the symptoms the child gets and how the pain behaves. They'll ask the child to do a series of movements to isolate what structures are contributing to their symptoms and give them advice and exercises about how to self-manage their symptoms. Adolescents with patellofemoral pain are more likely to reduce or stop sports participation, so we need to support them to stay as active as possible. There's been lots of studies done to better understand how to support children. One of the priorities that children have identified helps them manage it is to have a diagnosis they can understand that does not provoke fear and explained in words they can use to tell others. They need honest advice about how long to expect their symptoms to last and how to self-manage and take control of their symptoms. The aim of treatment is to keep them as active as possible. If they do nothing, their tissues get even less tolerant of loading and the muscles will get weaker. However, it's important they don't cause more injury. Ask them these questions. How much pain are they in? Score it from 0 to 10, where we're looking at the least pain being 0 and severe pain being 10. Many children struggle with this concept, so maybe introducing mild, moderate, or severe can be helpful. Importantly, does it settle within an hour of stopping activity? Does it make them limp or have to play differently? And is it worse the next day or does it swell? If it settles within an hour, it doesn't cause them to limp, there's no increase in swelling and it's no worse the next day, then we can often find that they can continue to play with that mild amount of pain. However, if their pain is greater than a 2 out of 10, they may need help to get it to settle. Sometimes applying ice packs can ease the pain, but it's really important that we don't give them painkillers, which could mask their pain and mean that they do more than their body is ready for. Sometimes wearing a small knee brace can help, or they could be taught to apply tape. And the objective here is to try and help them to stay active as much as we can. One of the important parts is if the child is doing less and their knee hurts, their muscles will get weaker. It's important to start a graduated strength program for the calf, the hip, the thigh and the trunk muscles. And it's critical to get the right exercises for each child and to know how to do them correctly so they're felt in the right places and achieve the right effect. So it's best to get them assessed by a clinician with experience in knee problems, but in particular, those who are used to seeing adolescents. If the pain is persisting with still playing sport, they may need to take 2 to 4 weeks off from all high impact activities such as jumping and running to allow the symptoms to settle. After the pain settle, it's important not to go straight back to doing the same high levels of sport they were doing when they got injured. Build back up gradually so their body can adapt to what is being demanded of it and get itself strong. Pain is aggravated often by a spike in activity relative to what they've trained for, such as at the beginning of a new school year or a new sports season, when their step count or activity level suddenly spikes. They may exceed their current capacity. It might be that they did too much too soon, or their capacity might be lower due to a virus, a growth spurt, or a lack of adequate sleep or nutrition. To learn more about this, watch the Kids Back to Sport video on why children get injured. To help them get back to sport, try using the Kids Back to Sport tool. Find a level of activity on the steps that they can do with minimal pain and settles quickly without causing more symptoms the next day. For example, they might be able to go on their bike, but not run. Initially, leave a day between exercise sessions to assess if there's been any adverse reaction, and then repeat that same exercise twice before moving on. If there has been no increase in symptoms, move up the steps one level and repeat the process. It may take several weeks or longer to achieve their previous level of activity, but doing it gradually allows the immature bone time to become stronger and tolerate more load. Once they can run, they're not yet ready to go straight back to sport. Start to add changes of direction, stopping and starting drills, and building up the number of sprints they do to replicate the demands of the sports they play. In those early matches, limit the game time and allow a day between matches so their body can adapt to the new stresses being applied. These types of conditions can last many months if not treated appropriately. So if after trying to reduce their symptoms down, your child is still in pain, it's often helpful to see a health professional who has experience in treating young athletes. Not all practitioners have the knowledge or expertise to treat children, so check those listed on the Kids Back to Sport register or ask your local therapist whether they regularly treat children.